7 deadly sleep mistakes for seniors, and simple fixes you can start tonight. Introduction: why sleep is a lifesaver after 60. Did you know that, according to the CDC, Centers for Disease Control and Prevention, more than 70,000 seniors die in their sleep every year in the United States alone? This number is not simply because of old age, but largely due to small bedtime habits that seem harmless, yet silently damage the heart, lungs, brain, and even safety during nighttime movement. After age 60, the body enters a particularly sensitive stage. The heart works weaker and is prone to arrhythmia. The lungs lose elasticity and become more vulnerable. The brain requires deep sleep to recover, but it becomes harder to achieve. Muscles and bones weaken, meaning even a small fall at night can cause serious consequences. The good news: these risks are preventable. By recognizing the most common sleep mistakes and making simple changes, you can protect your health. Let's uncover the 7 deadly sleep mistakes many seniors are making. Mistake number 7: drinking too much water before bed. Water is life, but drinking too much right before bed can turn a peaceful night into a dangerous one. In old age, the kidneys process fluid more slowly, and the bladder is smaller and more sensitive. As a result, you may need to wake up several times to urinate. This sounds normal, but every nighttime trip carries risks. Dark room plus poor balance, risk of falling. Sudden drop in blood pressure when standing, dizziness, or fainting. According to the CDC, falls are the leading cause of emergency hospitalizations among the elderly, with many accidents happening at midnight. Interrupted sleep also leads to chronic insomnia, memory loss, higher Alzheimer's risk, weakened immunity, extra strain on the heart to handle excess fluids. Solution: drink plenty of water in the daytime, taper off in the evening. Avoid large amounts of liquid at least 2 hours before bed. If thirsty, take only small sips. Install night lights or motion sensor lights to prevent falls when going to the bathroom. Mistake number 6: late night eating. After a long day, many enjoy a bedtime snack. But for seniors, this habit can be dangerous. Harms: acid reflux. Lying down makes stomach acid rise easily, causing burning chest pain or even aspiration pneumonia. High blood sugar. Sweets or refined carbs spike glucose at night, risk of type 2 diabetes. High blood pressure and arrhythmia. Salty, fatty foods force the heart and blood vessels to work harder. A study in the Journal of Clinical Endocrinology and Metabolism, 2020, showed that eating within 3 hours of bedtime significantly increases glucose problems in older adults. Solution: have dinner at least 3 hours before bed. Choose light meals, vegetables, lean protein, whole grains. If hungry later, opt for banana, unsalted nuts, or plain yogurt. Mistake number 5: wrong sleeping position. Comfortable does not mean safe. For seniors, sleep position can directly affect the heart, lungs, and brain. Sleeping on the back, the most dangerous. Tongue and throat tissues block the airway, 40% higher risk of sleep apnea. Acid reflux is more frequent. The brain's waste-clearing system is less effective, raising Alzheimer's risk. Sleeping on the right side, also risky. Puts pressure on the heart, reduces circulation. Best solution: sleeping on the left side. Improves circulation. Reduces reflux. Helps the brain clear toxins more effectively. Tips: place a pillow behind your back to avoid rolling over. Use a pillow between knees to keep hips aligned. Elevate the head of the bed 10 to 15 centimeters if reflux is frequent. Mistake number 4: sleeping in a hot bedroom. Seniors often love warmth, but a hot bedroom is the enemy of deep sleep. Harms: temperature above 20 degrees Celsius, 68 degrees Fahrenheit, prevents the body from cooling harder to enter deep sleep. Sweating, dehydration, thicker blood, higher risk of stroke and blood clots. Weaker immunity and faster memory decline. Solution: keep room temperature between 15 to 19 degrees Celsius, 59 to 66 degrees Fahrenheit. Use cotton sheets, thin layered blankets. Use a fan or crack a window for airflow. Mistake number 3: getting up too quickly after waking. It seems simple, but for seniors, standing up too quickly can cause dangerous falls. Cause: orthostatic hypotension, a sudden drop in blood pressure when moving from lying down to standing. Result: dizziness, blurred vision, even fainting. This leads to thousands of ER visits each year for hip fractures and head injuries. Solution: sit up slowly, dangle your legs, breathe deeply before standing. Keep a glass of water by the bed. Sip before getting up. Wear non-slip slippers. Keep night lights on. Mistake number 2. Ignoring snoring, apnea, or chronic insomnia. Snoring is not just annoying. It can signal sleep apnea. Patients may stop breathing dozens of times per night. Each pause lowers oxygen, strains the heart, increases risk of stroke by 60% and fatal heart attack by 30%. Chronic insomnia triples the rate of memory decline. Solution: consult a sleep specialist if you snore loudly, gasp at night, or feel tired all day. Treatments: CPAP machine, weight loss, exercise. Avoid alcohol and sedatives before bed. Mistake number 1. Taking the wrong medication before bed. Many seniors take nightly medication without realizing some drugs increase risk of death. Sleeping pills, benzodiazepines suppress breathing, cause falls, increase early death. Muscle relaxants and antidepressants reduce deep sleep quality. NSAIDs, ibuprofen, diclofenac damage liver/kidneys, raise risk of internal bleeding. Blood pressure meds at wrong time may cause nighttime hypotension stroke. Solution: only take medication as prescribed. Consult your doctor carefully. Limit sleeping pills. Try natural methods like chamomile tea, meditation, deep breathing. Monitor blood pressure and report unusual symptoms promptly. Conclusion: small changes, big protection. Sleep is not just rest. It is the body's repair station for the heart, lungs, brain, and more. For seniors, quality sleep directly determines longevity. By avoiding these 7 deadly mistakes: don't misuse nighttime medication. Don't ignore snoring or insomnia. Don't stand up too quickly. Don't overheat the bedroom. Don't sleep in the wrong position. Don't eat late at night. Don't drink too much water before bed. You protect your heart, memory, bones, and safety. Start tonight. Make small habit changes for safer, deeper sleep and a longer, healthier life.